turned therapist. Our focus in these episodes is to humanize the athlete experience beyond the lines of their arena. In this podcast, we will explore the whole athlete, highlighting the mental, emotional, and social aspects of their journey.
Welcome. My name is Lilly Wehman, and I'm a second-year social work student at the University of Chicago and current clinical intern at Millennium Counseling Center. And today we have the pleasure of Sarah joining us, and we are going to have a conversation about athletes' mental health and substance use. Sarah, if you would like to introduce yourself.
Yes. Thank you for the introductions, Lilly. Excited to do this with you and be here. So yes, I am a mental health therapist, psychotherapist, licensed professional counselor, whatever you would like to call it, for Millennium Counseling Center, which is a private practice in downtown Chicago. We specialize working with all different populations, some specifically within the addiction sector, and then others, really anybody within the city of Chicago, or Illinois. But I actually run the sports division of our practice, and we are focused on serving the athlete population. So athletes of all levels, elite athletes at, middle school to high school level, athletes at the collegiate level, and professional athletes as well, and even former athletes who played at the college or, professional level. So really doing any type of work with them within the mental health space, providing therapy for them and on an individual basis, and then also doing group work with them as well, whether it's going into teams and working with teams in regards to their mental health, coaches, trainings, you name it, really keeping that literacy and understanding of mental health at the forefront of athlete wellness.
Yeah. Thank you, Sarah.
You are welcome. That was a mouthful. I apologize.
No, I think that's awesome. And that's definitely all the things that you just spoke about are things that sort of gravitated me towards Millennium, especially focusing on athletes' mental health and their mental well-being in addition to their performance and not just adding additional pressure to performance pressures.
100%. Yeah.
So yeah, to jump right in, I have a few sort of stats for us from the 2024 NCAA report. So to start us off, 72% of student athletes reported drinking alcohol in the past year, which is actually a decrease of 11% since 2009. Current national studies of general college student body suggest that this student athlete number is actually pretty similar to the general student body that has reported drinking alcohol. Another fact is 68% of student athletes use cannabis either for fun, enjoyment, and then 53% for relaxation, 38% to help with sleep, and then 17% for medical use, whether that be like alleviate physical pain because of their sport or other things that they're going through. And then another thing that I wanted to touch on was probably nicotine and tobacco. Those products that were used were probably either e-cigarettes or vapes. 22% of student athletes reported vaping at least once in the past year, followed by 12% of student athletes reporting smoking cigars, and 10% spit tobacco, and another 10% using cigarettes. So that's just sort of the lay of the land at the beginning to get us started. But I was sort of curious if this is sort of showing up in your work and what your student athletes are experiencing and coming to you with as like common stressors or reporting substance use. And yeah.
Yeah, no, this is huge. I will say, I feel like it's shifted a ton over the past couple years. I honestly noticed during COVID, there was actually more use of certain substances. So even when you're hearing that it's actually decreased within athletics, I can concur with that. I do agree with that. I also just think our culture as a whole in society has changed a ton when it comes to even like this drinking culture, this new age era around alcohol and what it's actually doing to our bodies. And I feel like there's been a lot more psychoeducation around that in general for the student athlete population. Now, that being said, one thing I will say is I've seen a ton of issues related to nicotine, which is interesting too, because it goes along closely or ties closely with dopamine addiction as well, or dopamine dependency. So chasing dopamine as a means or form of an escape. Now, I'm sure there are so many stats that have come out about this, and I know we chatted about this previously, but things along with vapes, I feel like has just increased so heavily. I have seen, athletes I work with addicted to nicotine, addicted to vapes because of the lack of education there was around it prior, especially during COVID, especially 7, 8 years ago when it started becoming more introduced, less regulated. Now it's being more regulated, thank goodness, but less regulated. And, we're having high schoolers, we're having freshmen in college, we're having even middle schoolers hitting these things without even recognizing what it's doing to their brain health and neuroplasticity, but then also the body's ability to get, addicted to something extremely quickly without the knowledge or awareness that they're actually addicted. So that's another thing. I think there was a lack of awareness at the beginning, and now we're seeing this new age shift of people trying to essentially curb that addiction or work through that addiction when it comes to nicotine, when it comes to vaping, when it comes to these forms of escapism. But I will say I have noticed a decrease in that over the past, I want to say 2 to 3 years. I will say that.
Yeah, to sort of go off with what you were saying about sort of entering this new era, things that I've talked about in my classes at U Chicago have been a lot of my classes. My colleagues are school social workers. So they're in school, meeting with people outside of class and all of that. And they actually sort of explain to the class to be on the lookout for these like new types of vaping devices or like e-cigarettes or whatever. Literally, I remember they showed there's like a certain sweatshirt that you can get where you can like put your vape in your sweatshirt so you can be vaping it during class. And another one, which I thought was wild, was literally like a vape disguised as a highlighter. So it can literally come off to your teachers, to any other sort of adults in the room that could be able to punish you or sort of, I don't know, just yell at you for vaping in class.
Oh my
So
goodness.
yeah, it's interesting also like the marketing and companies kind of just trying again to monetize off of these children's like addiction.
That is so sad.
Mhm.
In my eyes, that is not okay.
No. Yeah. So you talked a little bit about that dopamine like reward system connection. I was sort of wondering what else you had to say with regards to like different substance use theories, whether you see some like genetic links and can kind of link back to maybe some family components, more of maybe a social learning theory where it's the people you're hanging out with or things are being modeled or different coping skills. I feel like is maybe a big one, especially with this population, maybe coping with school stressors, like so academic pressures, social pressures, pressures from teammates, pressures from coaches. And yeah, so what sort of have you been seeing in that world?
Yeah, so I will always, as a therapist too, I always look at things from a biopsychosocial level. And one thing I definitely want to, touch on is this idea, is there a history of mental health illness or any type of substance use disorder or addiction in the family, right? With a parent, with a family member, and the likelihood of that it's occurring or has occurred within the family system, or if there is a history of mental illness, addiction, you name it. Yes, they are more likely to struggle with said addiction or substance use or any type of substance use disorder in the future. And so, their mental health also concurrently or co occurringly can really impact usage as well, and usage in a form of a coping mechanism or in some type of escapism. So history is huge. I think that you can look at that from more of a biological level and even social learning to a degree as well within the family system. What's normalized? If that is normalized, if they're seeing that all the time, then yes, of course, like that is going to increase their chances of use and unfortunately addiction. But the last thing I'll say on the contrary to this as well, when working specifically with athletes, another huge piece of this is how their brain works. And so, no, I'm not, what is it, a neuroscientist, but I really go into cognition and how they think. And the way that a lot of athletes think comes from this, I like to call it this all or nothing mentality or this very black or white way of thinking. And when that happens, it's hard to find balance, either because they are, they're going 100%. It's like a 0 to 100 really fast. So it's kind of that the way I describe this is very like work hard, play hard. So when they are just giving so much to a sport or really fixed within this mindset, I've seen where that can affect them when it comes to substances because they don't do anything, excuse my French, half-assed. So if you're not doing something half-assed, right? Like you really get caught into that all or nothing. So when they're drinking, when they're boozing, when they're out in social situations, I've seen a lot of them overuse or misuse substances. Either one is a way of escaping their current reality as a coping mechanism, but also because I think they are using it as like, this is my opportunity to have some fun. This is my opportunity to let loose. But they get carried away with that. It's like a reward for them in a lot of ways, but at the same time, like there's an inability to stop yourself as well. So I think this oscillates. There's a lot about like mindset here and chasing dopamine. All right. There's this thing called anhedonia. And I've seen this happen with some of my athletes too after seasons, right? Like when you're in the middle of a season and you're just constantly like on it, whether that comes to these intense time demands with school, intense time demands with sport, and you're in the middle of season and you're just like boom, boom, boom. And it's like serotonin is moving through you, dopamine moving through you because you're playing at such a high level. And that's what comes along with being a college athlete or a pro athlete. But when you stop, a lot of what happens is you're actually craving that. You're
Almost
craving.
like a withdrawal.
It is like a withdrawal, 100%. So you're craving that dopamine. So there is such thing as dopamine depletion. And I do see that with a lot of athletes. I do see this kind of like, oh, this is why a lot of athletes get sick after season as well. All right. So there's a lot of similarities with this when it comes to substances because it's like they're trying to find that again. They're trying to fill that void. They're trying to recreate what it feels like in the body to feel such an intense high, to have endorphins racing like through your blood, through your bones almost. And they want to recreate that. Substances, you can consume that. And that exasperates that feeling or recreates it for them instead of them creating it for themselves through exercise and sport. That was a lot.
I wish you guys could see me because I'm definitely nodding my head in agreement and totally understanding what Sarah is saying. I think something that I do want to point out is sort of, again, that sort of like, okay, I just worked my ass off all week and I like turned in all my assignments. I went to all of my classes. I showed up to practice. We just finished our game. It's a Saturday night and we have Sunday off. Like, I'm going to go let loose and I don't really care. So I feel like in conversations with some of my student athletes that I've been able to work with here as an intern, I've definitely seen that play out for sure. I guess my next question is sort of like, what would be like some protective factors that you could work with your athletes to sort of like put into place that would sort of decrease this probability to then go into this all or nothing, chasing the dopamine type of mindset?
Yeah. I was actually just talking about this with a client the other day, and Derek, who is the president of Millennium, him and I have a very similar sentiment on this, and I've chatted with him about this as well. He was also a former college athlete and former professional soccer player. But in short, we were talking about how athletes really do an interesting job of operating. When you think of stress levels, we're very good at operating it from like, so 1 to 2 stress levels being like high, high, high stress to think of like an 8 to 10 scale, 8 to 10 being like they're managing that stress. They're in a complete state of almost joy and flow. But I feel like we oscillate a ton from this 1 to 2 to 8 to 10. We operate that in these different frequencies, but none of us really know how to balance this like 4 to 6. The 4 to 6 is where we get stuck. And oftentimes that has a lot to do with boredom. Okay. And that stillness and learning how to sit with yourself. And so I think there's a lot of discomfort in that. But within that as well, I always say, protective factors routine can be so helpful for them. I feel like we operate so much better when we have a little, but not always too much rigidity, but when we have more of a routine that works for us. Exercise as well, obviously. I think we need that. I don't know an athlete that doesn't need that, but learning how to find a healthy relationship with that as well is so important. But I always tell them too, like learning to sit with discomfort is the hardest thing, but I think that's one of the most important things in working with athletes and teaching them how to access what it is that they are feeling and finding just better coping tools for it, whether that be journaling, whether that be going for a walk, whether that be learning how to tap into that state of presence and flow that they do operate at when they are performing and they are playing at this almost like 4 to 6 level, which is just like, hey, like get outside of your own head, slow down. We don't have to be productive all the time. We don't have to be operating at this intense frequency or the other way around. Like, get outside, find other outlets for yourself. And finding other outlets is also just as important. Even your identity outside of sport is also just as important. Social connections, another huge one, can be really helpful. And, I will say like more and more athletes are coming out about their around issues with substances. So I think community is huge too. So those who have chosen, those who are in recovery, those who are in, a phase of exploring sobriety and what that looks like to them. So yeah, I think social relationships is also a huge one as well.
Yes, that was going to be sort of my next question, going off of that connection piece and when people are sort of making the decision to sort of assess what their relationship is with a certain substance. What does treatment look like? How are you there to be helpful and sort of a supporter in someone's decision? Sort of what does that look like?
Yeah. Yeah. When you ask this are you referring to those who are just like, I call it like being sober curious, or are those who are really like in a stage of I'm committing to sobriety and recovery?
I feel like I would maybe go with sober curious only because that's probably not talked about as much
Yeah.
and maybe more of what we're seeing in our work.
100%. I mean, because yes, there are people and there are athletes and there are clients in general who are doing deep work or in recovery or who are, who have gone inpatient or have gone to treatment because they know that a substance, they're struggling with addiction essentially, or that substance, has really infiltrated their life and has affected every facet of it. So there's that piece. But I think for the majority, when working with athletes, one of the things I like to explore with them is their relationship to the substance. That's more this like sober curious mindset of like, okay, what is your relationship to it? And if and when you do utilize the substance or you notice you pick up the substance, right? Or you use it, what are we feeling in our body? And then sometimes we talk a lot about boredom. Some of this also is straight up boredom
Fixation.
and fixation. Yeah. And it's been a coping mechanism for so long, or it's been normalized in our culture for so long, especially in college, right? And I'm starting to see some of my athletes who have graduated, some of my clients who are now 25, 26, who were once college athletes, and they're like, I can't drink the way that I used to drink in college. And I'm like, yeah, because it's so normalized. So that's a whole other conversation around the drinking culture and at college, which truly can lead to addiction. And I'm seeing it play out in a lot of my college athletes. I have some, who had to take time away from sport because they don't understand to their own tolerance. They don't even understand their relationship to it at 21 years old. So that's another piece of this is understanding the relationship to it, exploring what it means to them, and exploring maybe why we hold so tightly or we have such a tight grip on the substance and what it's altering and what it's doing for us. And then also how it hurts us. So really understanding too, are the consequences actually outweighing the rewards here too?
Yeah, that makes a lot of sense. To sort of like, I know that was sort of how we were framing treatment and what treatment looks like for someone being sober curious and sort of working through that. Would you say that's similarly how you go about sort of assessing for any sort of maybe misuses that is happening or problems that are coming into a client's life? You feel like you sort of ask those types of questions as well?
100%. And yes, 100%. Frequency is a huge piece of this too. How much of the substance are they utilizing? But at the end of the day, one of the most important things is what are the consequences to them utilizing this substance? Can they stop? Can they not stop? And how is it affecting their external world and then also their internal world? If there are relationships, if this is infiltrating their relationships and affecting those around them, that's when we need to pause and take a good look. If it's also affecting and infiltrating them, how they feel about themselves day in and day out, if it's creating more issues related to their mental health, whether that be anxiety, whether that be depression, and also a lot of the times too, this whether, it's like sometimes it's not what came first, the chicken or the egg. It's the fact that it's co-occurring at the same time. Their mental health and addiction is also, or substance use is affecting one another at the same time. So really understanding and looking at both pieces is really important.
Yeah, something that we have spoken about in our classes is just sort of this understanding that a dual diagnosis is more of the norm than it would be an exception. And many clients definitely present with more than one comorbid disorders, which is sort of what you were touching on with whether it be depression, anxiety, or
Bipolar disorder.
any sort of
Yeah.
anything.
Especially when it comes to bipolar disorder. Gosh, I wish I had the stat on this, but I know those who struggle with bipolar disorder, they are more likely to misuse substances than those who aren't or don't due to, the type of manic episodes that they experience, or hypomanic, yeah.
Another thing that I sort of wanted to bring up was, again, going back to what you were saying a little bit earlier about sort of sometimes often I feel like we paint this picture in class or in supervision or when we're just chatting about things. It's like client will come in and say, but I don't think I have a problem. And then like a common question will be like, okay, so then why are you here? And normally you hear something with, oh, my partner or my mom or my dad or my coach. And it's like, okay, so you may not think it's a problem, but let's sort of like zoom out and look back and realize that it is maybe affecting a different portion of your life. So I think that sort of just points to what you were saying earlier.
100%. And that also points to why you're going to be a great therapist, because that is exactly how you should look at it and view it. And it's hard for them to scope it. It's hard for them to look inside of themselves. But, the thing is, deep down, they're here for a reason. They might lose a relationship, but at the end of the day, it's their choice. They're making that choice. So on some topographical, unconscious level, there is awareness. It just might not be conscious yet.
Yes, that makes a lot of sense. Also, something that I sort of wanted to touch on is sort of when taking into consideration how a client is showing up and sort of any intersectional identities that they may be holding. What about this? Does your approach change? Do you sort of ask maybe more questions and more like to learn about different parts of their lives or certain things that are happening at home or cultures and different norms? So how may you approach it if there is someone in your office who either is holding an identity that isn't similar to yours or something that you may not be as familiar with?
Yeah. Yeah. I feel like that goes back to multicultural counseling, and there are tons of different identities, how people identify, whether that be within their race, socioeconomic status, ethnicity, age, sex, oh gosh, gender. I'm trying to get all of them, but inclusivity is so important here. And there is this massive intersectionality piece of trying to understand how the substance affects them, but then also how it affects their identity or their culture. And different cultures actually utilize substances differently as well too. So it might feel normal or more normalized. For example, like a white male of 25 years old might look very different for an African American female who is 35 years old. And how they use it, again, depends on kind of personal, for whatever personal reasons. But yeah, I just think utilizing multicultural counseling is very important within that space as a whole. Like, okay, I have an example. When it comes to gender identity or gender fluidity, that is a huge thing too, is understanding. I mean, different substances affect people differently as well, but understanding maybe too, like they're utilizing a substance to block or to mask or to cope with this other identity that wants to come through. And there's a lot of fear in expressing self and articulating how they identify when it comes to their gender and quite honestly how they view themselves. And so the substance then becomes the Band-Aid. The substance then helps block this, authenticity that wants to come through, but due to fear of how they might be perceived through social relationships, especially within athletics, there's a lot of fear there. So the substance is a crutch. The substance is a coping mechanism.
I think something, at least for me, that's coming to mind when I'm listening to you speak now is just as a therapist that's sort of about to like go on and start and am very much in this like learning space. Something that comes up for me is just sort of this kind of intention to always remember to be curious and like not know the entire story and just sort of like there could be something that's showing up for you. It's like, oh, I know why they're doing this. Like they're doing this to alleviate XYZ or to run away from this. And it's like, wait, I don't want to just jump in and sort of put what I may be thinking is happening here, but to always step back and just remember that there's always more questions that could be asked. And there's definitely things that are going on that you may not know or that you may even have no idea about. So I think sort of to wrap this up, I think that's sort of one thing that I am sort of sticking with and want to bring forward in my work as a therapist soon. Sarah, what are you thinking? Is there anything else that you want to sort of mention or chat about?
I mean, Lily, you did an amazing job with this. I love this whole thing about staying curious. I feel like, God, you're just like taking the words from me, girl. I need this. This is great. This is making me look inward as a therapist as well. But no, I really appreciate the time here and us chatting about this because it's really important within the mental health space in general. It's important for anybody, but really, working with athletes specifically, I think this is going to shed a light on the things that could be going on and things that are actually going on. But yes, I really appreciate you and your time, and you're going to be a badass. I can't say that. You're going to be a baddie therapist.
Thank you.
You're welcome.